with your classmates, 5 minutes, okay?
Okay.
Okay, I'll be back. Pablo, can you make me a favor, please?
Sure.
Please let me know if you can watch the pool. Just watch. I'm trying a new device.
Yes, I could watch it.
Okay, perfect. Thank you. It works.
Yeah.
So let's cross fingers and not have any disturbances with the web connection.
Yeah, let's hope so.
Yeah, it's necessary to get it well. Okay. Hi, Diana. Okay, can you watch my screen?
Yeah.
Yes.
Okay, great. My internet connection has a little bit troubles, so let's cross fingers for not missing this transmission. I think maybe the screen might get in black, but my audio is gonna continue with a second device. Okay, so let's try to work it in the best way.
Okay, no problem.
Okay, can you hear me clearly? I'm changing device.
Yes.
Okay, great. So let's start with this. If the screen fails, please, I'm sorry, but I'm going to try not to get into this trouble. At this point, I'm alone, but I don't know what's going on with this. Okay. Tonight, we are going to check the integumentary system in the skin, the eyes and ears as the two senses that we have into the program, and a general view about infections. Into infections, we are going to check a little bit about sepsis, that kind of troubles, and how we can get the red light and how to start acting on. We are not going to talk about antibiotics at this point because it's not an objective in this class. In the module 2, we have the chance to do it. We have the chance to report labs, to check medication doses and things like that. At this point, it's not an objective. I'm gonna say it again. So let's go. Here we are with our first anatomical review. We have the red guy in order to check and to practice on this. And now we must consider all the structures. This is a general chart that we all had the chance to check during the medical school, of course. And we all had the chance to practice on this in order to learn the general way to check this. But when we go ahead and check this different chart, we have the chance to make the comparison between the hairy skin and the hairless skin, right? As you can see, there are differences that we might consider. For example, of course, the hair shaft, and then the hair follicle. That in the previous chart is not present, but just as extra information, right? For making the correct and the properly comparison, we took this because we can check different nervousness terminals, so it's a good way to do it. And in the hairy skin, we got the sebaceous gland, the rector pili muscle, and details that maybe making a comparison are not present in all the skin. Please study this, check these structures. Of course, we have to consider this, the nails. During the nails, we have its own parts and structures, of course, same as in Spanish, of course. We have the free edge of the nail body, the cuticle, the lunula, and the nail bed, of course. And of course, the bone that it's into the finger. Then we get now the structure for the combining forms and functions. Going into major structures and related combining forms, we got this. When we talk about skin, we say cutaneo, dermato, or dermo. About the sebaceous gland, sebo. The sweat glands, hydro or hydro. According to the suffix, we change the pronunciation if it's possible. Going to hair, we can say pili or pillow. Into nails, onico or ungo. Okay. The word parts are pointing to this point. Cutaneo, dermo or dermato, hydro or hydro, according to the suffix. I'm telling this the same again. The hirsuto, kerato, lipo, melano, nico, onico, pili or pillow, Payo or pio according to the suffix or the prefix. Raitido or raited. Cibo, yurtic or yurtico. And cero or zero, okay? Okay, let's check this first idea, this first concept. What is a skin lesion? Of course, we all have the chance to suffer from this. We all have the chance to live or maybe check patients with skin lesions. We must remember, any skin area that has different characteristics from the surrounding skin, including color, shape, size, and texture, is a skin lesion. Everything that looks different, right? We all know we have the primary lesions, primary skin lesions that are all of this chart. This is just an example. We got macule, papule, nodule, tumor, plaque, wheal, vesicle, bulla, and pustule. The first ones. Of course, we have the chance to check some more. We are getting into the secondary skin lesions, so we can say scales, crust, fissure, ulcer, scar, atrophy. Okay. No, this chart is so important. Why? Because I'm going to consider this into homework and final test, okay? This is skin lesions, of course, similar to Spanish, got a medical term, then a common and social word, the way how patients explain to us, and now the features, the characteristics of the term, of course, of the skin lesion. For example, we got macule. A patient could tell you, I got a spot. And now, well, we got the meaning, not raised above the surface of the skin. Or maybe a vesicle. Patient says, small blister. Of course, it's filled with fluid. Moreover, we can get, for example, a crust. Patient can say scab. And the meaning, dried blood, etc., on the surface, of the skin. Then we got, for example, the fleshy nevus, the mole. In some books, mole is related to the medical term. Why? Because mole is a very, very, very common way to consider this. Fleshy nevus, maybe just for dermatologists in the proper way, but even for general practitioners, mole is the properly way to talk about this skin lesion. A raised brown nevus, a new one, right? For example, furuncle, a boil, a large pustule, or a skin abscess. You know, we have to take this in account because when patients come to us, they are not going to tell you, hi doc, I got a papule on the arm. No, they are going to say, I got some spots. When you evaluate this, you catch that it's a papule, and then you describe papules on the left arm, for example, next extension, how many parts of the skin they are taking on. More human skin conditions are this: acne, urticaria, pityriasis, bruise, eczema, lichen planus, psoriasis, and hives. Easy to catch. With the picture, I think it's easier, and all of these skin lesions, these skin conditions are so common. Now let's go with pictures and the best way to consider to catch the meaning of them. And of course, some skin lesions, some more details to memorize at this point. We got a brow, comedon, macule, papilloma, papule, petechia purpura, plaque, pustule, scale, telangiectasia, vesicle, wheal, You can notice this. We got will without a H, and then we got will. Here, I'm gonna show in the next pictures. Will with H. Both of them are the same. One is British English, the other one is American English. British English is with the H. American English is without the H. Well, the same. Bulla, macule, nodule, patch is a new one. And then you have some descriptions about this detail. The descriptions is just for catching more vocabulary and the way to describe these skin lesions. Papilla, plaque, pustule, vesicle, well, all of them were. Okay, here's the wheel. This is the same than the previous one, just changes the age. The wheel, scale, crust, fissure, excoriation, erosion, lichenification, scar. And now just for an extra detail, an easy way to evaluate the skin lesions are considering the elevation. If it's yes, we can consider them if it's solid. If it's no, could be pus. If it's not pus, we consider the size. And if it's yes, is there is pus, it's a pustule. Easy. According to the size, we consider if it's a vesicle or a bulla. That's the only difference in them. Then we can get, for example, elevation, size. No elevation, we consider the size. Could be a macule or a patch. Easy to catch. If it's solid, we say yes. It's transient, we can say yes, it could be a wheel, or no, depth. We can check if it's depth or not. If it's superficial or is depth, it's a nodule. If it's not depth, we get the size, a papule or a plaque. Easy to catch, just for practicing, maybe to catch a way to memorize all of these situations, right? A very common situation for getting into the consulting room are the rashes, of course. Rashes that all of us get in a moment in our lives, maybe when we were kids, who knows, but rashes are a way to catch or to understand these situations. And then we have some expressions to receive this. Going to the concept. Rashes. A single skin lesion can be regular or irregular in shape. When there are many lesions, I mean multiple lesions, especially macules or papules, the result is a rash. Or in common language, spots, as we were checking in the previous chart. For example, the rash of an infectious disease, such as rubella, right? A rash is said to erupt or break out. For example, a mother could say, my little boy has broken out in spots all over his body, similar to the picture. Or could say, my little boy has erupted in spots all over his body, or has broken out in a rash all over his body. Both of them, broken out or erupt, are correct. Spots or in a rash, of course, are correct, because it's the way that the patient is talking to us. They are not going to tell us, my boy has macules. Of course not. It's not going to happen. We don't have to dream on it. We have to memorize these common expressions too. This is an extra chart just for showing you extra vocabulary. When we check the location, shape, size, color, and type of the skin lesion, and according to the pictures, maybe we can catch how to memorize the way to describe it properly. The typical distribution of papuloschimous eruptions in children. Atopic dermatitis, for example, that's the way, and cheeks, the elbows, and then the knees. That's enough. Elbows and knees. B, seborrheic dermatitis, usually located on the scalp, behind the ears, tight creases, right? You can check, and in eyebrows. The scabies, usually located on axilla, webs on fingers and toes, and in the little area. That's the way when we have to show this information, the way that we must use this. Okay, the way we must describe this skin lesion. For a rash, we also have to consider this distribution and grouping. Distribution, they could be widespread, I mean many parts of the body, like this, I don't know, hands, legs, maybe the thorax, or who knows, or localized, only one part of the body. I mean, on the fingers, on the body, on the scalp, okay? And grouping, they could be scattered, more or less even spread out, like this, or in clusters, in small groups, like this. This one could be called clusters, and this one scattered, okay? Now, just for practicing and catching more vocabulary, we got the normal skin, how it's organized, how it protects. And when we compare this normal skin to the eczema skin lesion, we get the penetration of allergens. And according to that, we can notice the difference in the structures and organizations and how it works, right? Eczema is a condition characterized by a skin inflammation that tends to be transient in nature. It's aggravated by environment factors and is characterized by red inflamed skin. I think we all had the chance to check an eczema. And well, is it possible to catch two in the comparison, right? Then we have for self-study, the eczema and the explanation how it is, how this structure is. We got the viral rash, typically splotchy red spots that appear in the small patches or across several areas of the body, right? Then we got the poison ivy or poison oak. We get this. Then we have the drug or food reaction with this. Then we get the heat rash. Now we have the intertrigo and then the back bites. So read all of this information. It's very interesting. And now it's the best way to catch and memorize information just by reading. This slide is showing us the causes of rashes all over a child's body. Why child's? Because it's very common to check these skin lesions in kids. So some possible causes: viral infections, autoimmune reactions, slap chest syndrome, fungal infections, Neisseria meningitis, humidity, or the allergic rash. Just this information, but we have some pathologies to consider here. This picture, I know it's funny, it's just like a joke, but from these pictures, I got a very good way to describe these situations. For example, in color, we might consider skin lesions if they are pink, red, more red, I mean burgundy, they are purple, or has lots of colors, right? Multicolored. About morphology, we got bumpy. Well, this bumpy is not correct, but it's just for making a comparison. Fluid field, pus field, all oozing and gross. It looks terrible. About size, small, medium, large, really large, and huge. I mean, the extension, the size, taking into account the structure in the body. It's just like a joke, but it's possible to consider this information to organize the idea and then use the correct vocabulary. Now we get the injuries to the skin, and we must consider all of these details. We got open wound injuries, okay? So this type of skin lesions are so common. and they are characterized by a break in the tissue of the skin that can cause bleeding. The causes of open wounds are endless, of course, we all know about it. And they can be classified as internal or external, or maybe a combination. We got amputation, avulsion, crust injury, puncture, abrasion, and laceration. Types of wounds. Okay, just consider this, and now we are getting this chart to catch the meaning of them. For example, an abrasion, also called a graze or scratch, is superficial. Patients can tell you, I got a graze while walking, I got a scratch while I was on the bike and I fall down, or something like that, okay? Injury involving only the epidermis, which has been removed by friction, okay? Is linear, as in fingernail scratches, whereas a graze involves a wider area, as in abrasions caused by dragging a part of the body over a rough surface. So consider this. Okay, the graze or scratch. A contusion, also called bruise. It occurs when blood vessels in the skin are damaged. They change in color during the time, okay, through the time. A laceration, also called tear, is a wound involving both the dermis and epidermis. It's usually distinguished from penetrating and incised wounds by its irregular edges and relative lack of bleeding. We all know about it. Now we got injuries from sharp forces. We can say incised wound, also called a cut, or penetrating wound. Greater than the superficial length of the wound. For example, a stab wound can be caused by a knife, okay? Please check this, read this again. And now let's check some pictures to realize the meanings of this. The incision wound, laceration, abrasion, puncture, penetration, contusion, hematoma. Well, here we got all the description of this, all in detail. For example, puncture wounds are small and round, but can become deep if enough force is applied. The laceration, marked by a jagged, irregular tearing of the skin that can be caused by a number of sharp or blunt objects like knives or other sharp tools. Okay. The abrasions and the ulcers. Abrasions are marked by the scraping away of the skin, commonly caused by road rash or rock burns. Okay. Or ulcers are surface wounds that develop when the skin tissue decomposes into the presence of the skin sores. Okay, we are going to talk sores about in a minute, okay? The burn wounds, burning, okay, occur when the skin comes in contact with the intense surface sources of heat like fire, electricity, and direct sunlight. We all know about it, about burnings, okay? Now we got this classification of burn severity, just text information in order to catch vocabulary. We got the first degree burn, second degree, and third degree burns, also known as superficial burn, the first degree, second degree, partial thickness burn, and third degree, full thickness burn. Considering this, we got the difference and we can catch how it works on skin. This picture for catching the meanings, 1, 2, and 3, of course. And now we got the wound healing, how this wound gets healed, right? We got the wound, then we got the clot, the blood, and the clot. The clot becomes an scab and exudate, and it finishes with the scab. Okay, regenerated epidermal tissue. Then, well, this is a case report. There is an example how we can express these ideas. And we say, a 9-year-old boy presented to the accident and emergency department after he stumbled on and fell while running in a wood. He has received a blow to the head from a rock and has been scratched by bushes. On examination, a vertical laceration 1 centimeter long was noted on the bridge of his nose, just right of the midline. There were a number of superficial scratches on the right side of his forehead. His right upper lid was mildly contused. So you can notice, once I got an accident like him while driving a bike, my face was similar of him. But patience, long time ago. Let's talk about sores. Sores, of course, are a skin lesion that we all had a chance to check. The word sore is a popular term for many different types of skin lesions, especially infected lesions. A pressure sore is a skin ulcer caused by pressure. For example, pressure of lying in bed for long periods. In elderly people, in prostrated people that cannot move because there's no way to do it, they develop the ulcer, the pressure sore, this kind of ulcers, also known as bed sore in the common way, or the cubitus ulcer. A cold sore is a lesion caused by herpes simplex, like this. Okay, a cold sore, it's called cold sore. Its name is because when you break down, when you open the sore, the skin lesion, the fluid is without color, it's like water. That's why it's cold sore. Okay, the adjective sore means painful. For example, the sore throat. Okay. Now we got the pathologies in the chart. This list, as I was telling you, is for helping you for memorizing easily. We got the sebaceous glands with acne vulgaris, comido, sebaceous cyst, seborrhea, seborrheic dermatitis, seborrheic keratosis. Then we get the sweat glands, anhidrosis, diaphoresis, heat rash, hyperhidrosis, sleep hyperhidrosis. Then we get the hair folliculitis, trichomycosis axillaris, and excessive hairness, the hirsutism, abnormal hair loss, the alopecia, alopecia areata. Then we got alopecia totalis, alopecia capitis totalis, alopecia universalis, or male or female pattern baldness. About the nails, we got clubbing, we got koilonychia, I mean spoon nail, onychia, onychitis, onychocryptosis, ingrown toenail, onychomycosis, onychophagia, paronychia. About the skin pigmentation, age spots, albinism, chloasma, vitiligo. Okay, about the bleeding into the skin, contusion, ecchymosis, purpura, petechia, hematoma, surface lesions, crust, erosion, macule, nodule, papule, plaque, verruca, wheal, fluid-filled lesions, abscess, purulent, exudate, cyst, fistule, vesicle, bulla, skin lesions, skin lesions through the skin, lesions through the skin, the abrasion, fissure, laceration, pressure sore, puncture wounds, needless injury, the ulcer. Then we got the birthmarks and dermatitis. With the birthmarks, we got the pigmented birthmarks, I mean the mesomoles, the capsulate spots or stork bites. Capsulate, I mean coffee and milk. Vascular birthmarks, capillary hemangioma, port wine stain, okay? For dermatitis, contact dermatitis, eczema, exfoliative dermatitis, and pruritus. There are some more. Please check it. It's going to be for you. The erythema in all of its forms. The general skin conditions, all of its forms. For example, psoriasis and rosacea, urticaria. Then we got the bacterial skin infections, the carbuncle infections, then the cellulitis, gangrene, impetigo, fungal skin lesions or fungal skin infections, parasitic skin infestations, burns again, skin growth with all of these details, and the skin cancer. Check all of this information, please, for you. Now, abbreviations again, practice on them. As you can see, I'm sending some during the homework files, but now we are going to receive some more. They are necessary to check and review. And now let's check special senses, eyes and ears. We got again anatomical reviews. On the eyes, we did anatomical structures, external ones. Please check all of them. And now we have a cross section from the eyeball, and we can see all the anatomical structures, okay? Please consider them in order to practice properly and, well, memorize this. There is no other way to do it. Then we have the segments of the first portion of the eye, of the eyeball. And now more details, the 6 muscles that are in the eyeball in order to move it. And now we got the ear with its details, anatomical details that we also check during the med school, of course. Please, everything is in English, memorize this. Again, a cross section from the ear, the inner ear. We have the chance to evaluate all of its structures in detail. So, more views about the tympanus, the tympanic membrane, and then we got more structures. Please evaluate all of them. And now we got these structures, combining forms and functions. Just eye and ears, because according to the program, there are the senses we must consider at this point. So let's do this. The eyes are opto, optico, ophthalmo. With the iris, irido, irito. Lens, phaco or phaco. Okay, it's the same. The only difference is the C and K. Then we got the retina, retin or retinal, the lacrimal apparatus, dacrysis or dacrysisto or lacrimal. About the ears, accuso, accusto, audio, audito, otto. Outer ear, pin or pini, according. Middle ear, neringo, tympano. The inner ear, labyrinth, labyrintho. Okay. Well, again, the word parts, you know. If the hyphen is at the beginning, it's a suffix. If the hyphen is at the end, it's a prefix. If there's no hyphen, this is the word root. For example, blepharo, hypencosis, irido, kerato, miringo, ophthalmo, opia, hypenopia, opto-oto, pac, presby, retino-sclerotropo, tympano, right? Just for you. When we evaluate the senses, we got a process to make the examination. In black and words, we got the vocabulary we must memorize and practice without any trouble. And then we can say, when we consider the examination of the eye, we all, well, maybe some of us got this opportunity. And we know that we use some medicines and drugs into the eye, and that's the process. Look for squint, I mean strabismus, dropping of the upper lid, I mean ptosis, or oscillation, the eyes, or nystagmus. In the lid lag, the upper eyelid moves irregularly instead of smoothly when the patient is actually down. Then examine the pupils and note whether they are equal in size, they are regular in outline, even circular, they are abnormally dilated, or large, or they are constricted. They react normally to light and accommodation. Okay. They should come together or converge, and the pupils should constrict as the patients look at the finger. I mean, when we evaluate and move the finger in front of the face, we have the chance to evaluate if the eyes converge and if the pupils constrict. Check also cataract, or mean the opposite of lens. This process is just the general way how to evaluate the eyes. And now how we evaluate, how we make the examination of the ear. We prepare the otoscope and we check into the ear canal. We have the chance to position the otoscope to get the correct position and check the eardrum. It's the same. You have to check the shape, borders, if there is a lesion, if there is bleeding, pus, maybe those details in order to evaluate. The middle ear, of course, is not possible to evaluate at this point because it's behind the tympanic membrane, but that's enough. Just an information slide. What to expect during an eye examination. Eye chart reading, swinging, flashing tests. I mean, when we exchange lights from an eye to another, the cover test, confrontation visual field test, color blindness test, refraction, slit lamp exam, applanation tonometry. All of these are developed during the eye evaluation. And maybe we got the chance to live this. Maybe all of us. I think it could be. What we can detect by the compressive eye test, we can get refractive errors, cataracts, glaucoma, pterygium, retinal conditions. It's just an example. Okay. Let's go to this detail. I think very important. Hypertensive retinopathy. It's a very common situation through the time we had a chance to evaluate, to see during the med school when we get it, when we check into the eye, right? Talking to the hypertensive retinopathy, well, we know if hypertension appears, all of its complications come together, and we have to evaluate properly in care without trouble. This is a normal fundus when we check into the eyeball, and there are the changes that we could find in a patient. We got all of the details here, but read them just for practicing. Pathologies of the eye, of course, we consider the eyelids, additional and exopathologies, uvea, cornea, iris, and sclera, all of them. The eye as a fact, refractive disorders, the functional defects. Okay, check all of these ways of reading is for you. It's your information. About ears and hearing, we got the outer ear, the middle ear, the inner ear, and hearing loss. Checking the hearing loss, we can check acoustic neuroma, deafness, presbycusis, conductive hearing loss, sensory neural hearing loss, noise-induced hearing loss. Okay, practice on this. Check this practice. Now, abbreviations about eyes and ears. As you can see, there are 3 of them. In my opinion, easy to catch at this point. And now we got similar, some more in order to complete. Okay, they are related to the eyes in the most of them are related to the eyes, but take it in account for practicing, for checking that it's possible to read all of these abbreviations in an article or maybe in a book. Now let's talk about infections. Infections is a very huge topic, extremely big in my opinion. But we have to consider this to evaluate in order to catch more vocabulary and of course understand that it's possible to manage the situations. An infection is the invasion and growth of germs in the body. Okay, germs may be bacteria, viruses, yeast, fungi, or other microorganisms. Infections can begin anywhere in the body and may spread all through it. Okay. About microorganisms. So infections differ from other diseases. They have some aspects that they count. They are caused by living microorganisms, such as viruses or bacteria. I mean living, talking about viruses, because they really need a host, right? And bacteria, we all know it, they are independent. They can usually be identified, thus establish the etiology early in the illness, okay? Many of these organisms, including all bacteria, are sensitive to antibiotics, and most infections are potentially curable, unlike many non-infectious degenerative and chronic diseases. So we know if we got the correct treatment, they might be curable, of course. When we check this chart, we must take in count that we got a reservoir and we got a susceptible host. The spread of communicable disease is how this reservoir sends us the microorganism to the susceptible host, and the susceptible host gets infected. Direct if it's from the reservoir to the host, and indirect if it's related with the airborne vehicle, vector, inanimate, or intermediate host. All of them, well, the microorganism that the reservoir has needs one of these ways to get into the host. Okay. Communicability is another factor which differentiates infections from non-infectious diseases, of course. The transmission may lead to an outbreak or epidemic according how it begins, okay? Many infections are preventable by hygienic measures, by vaccines, especially live attenuated vaccines such as rubella vaccine, or by drug prophylaxis. For example, chloroquine to prevent malaria. In context about COVID-19, we all had the chance to live a pandemic period. It was not things on this period, but it happens. We got the wash hands, we must use soap, we avoided crowds. We are actually, nowadays, we are still using masks. We are avoiding shaking hands, and we still use disinfection in order to avoid this kind of virus, right? Just a way to remember when to wash your hands, just extra information. And now we get this. As I was telling you, microorganisms could be bacteria, viruses, fungi, protozoa, okay? Parasites, of course. A general word for these pathogens could be microbes. But patients don't use microorganisms or microbes. They say germs or bugs. Both of them are showing the idea, are referring to microorganisms or microbes. That's the way to translate, to make the comparison, okay? For example, the soil microorganisms, bacteria, fungi, algae, and protozoa. Notice the common expressions in it. When you talk with a patient could use both of these verbs, caught or pick up. Could he have caught some disease from the dog? Or I think I've caught the flu bug that is going around. Another way, could we have picked up some disease from the dog? I think I've picked up the flu bug that's going around. So you can notice there two verbs so important because that's the way patients go to doctor and make the idea, okay? Let's consider this chart when we talk about fever. And we consider this case. A 24-year-old man presented with a fever, which he had for 3 days. On the third day, he had severe attack of fevers with sweating and rigors. The only past history of relevance was hepatitis 4 years earlier and glandular fever, an infection with Epstein-Barr virus. At the age of 18, now he had returned from Africa 3 weeks previously. When we go to the meanings, we check this. Fever could be called pyrexia. Also remember PUO, pyrexia of unknown origin. Fever, also known as temperature. When we talk with patients, it's a very common expression. I've got a temperature. I've got fever. I've got some fever, they could also say. When we translate into, or we exchange it into adjectives, we say feverish or febrile and pyrexia. The opposites are febrile or hyperexia. Symptoms of fever, of course, sweating. We check it in the class 1. We had the chance to ask for it, but nobody said anything. And rigors. Rigors at this point are severe shivering and sensation of coldness, also known as chills. Chills is a common way to talk about rigors. Rigors is the medical name, is the proper name. But chills is in order it's more common. Both of them can be read in an article or a book. Talking about common signs and symptoms about infection, we have the chance to check in this chart the situation and some answers on some microbes that are involved in this. Fever, occur several medical conditions: drowsiness, respiratory symptoms, diarrhea, abdominal pain, skin rash, difficulty feeding and or vomiting, rhinorrhea, conjunctivitis, and headache. All of this, some viruses and some parasites, some bacteria, so consider this just extra job, okay? Then we got the difference between bacterial and viral infection. With the bacterial infection, we got these details. With the viral infection, there is only make it the contrast. We can say the key signs include symptoms lasting longer than 10 to 14 days. In bacterial, in virus, they are less than a week. They are, for example, due to influenza virus, the flu, symptoms respond well to an antiviral medication within the first 24 hours. Fever can become exceptionally high. Fever in the bacterial. In viral, fever eases with time. In bacterial, fever gets worse over time rather than improving. In viral, fever is uncomfortable, but usually not dangerous. So we can get, of course, with bacteria, we get the chance to get worse and, well, not recover, and then maybe get in a very complicated situation. It's just a comparison for reading and catching the proper vocabulary when we talk about the bacterial and viral infections, the facts they have in common, and some details to consider. Extra reading. And this chart is just for making a comparison and finding how to express properly in COVID-19, cold or flu. For example, fever in COVID is sometimes, in cold and rare, in flu is common. Another one, for example, fatigue. COVID is common, in cold sometimes, in flu is common again. So practice on this, read, because all of these situations are going to be on the practice daily. It's an extra chart just for practicing. I'm sorry, my internet is failing. Please give me a minute to correct the situation and share again the screen. Okay, give me a minute, please.
Okay.
Okay, can you watch my screen now?
Yeah.
Okay, thank you. So let's go. There are no some more slides. Patience, please. Well, sorry for this situation. I don't know how to solve it now because it's out of my hands, but I'm gonna find a way to make it properly. Okay. So let's see. We have the classic signs of infection that are pyrexia, pain, edema, increased exudate, inflammation, and erythema. So you can see edema here is with an O at the beginning. It's British English. In the American English, it's the same as in Spanish, just with E, edema, okay? Additional signs of infection: delayed healing, dark or decolored granulation tissue, fragile wound tissue, malodure, cellulitis, puckering at the base of wound, abscess formation, painful altered sensation around wound bed, okay? So these signs and symptoms are extra information for catching more specific vocabulary. Talking about sepsis, we got this extra information because it's important to talk properly. We got two clinical stages: the severe sepsis and septic shock. That's the way we talk about it nowadays. Introduces a new diagnostic tool, I mean quick SOFA or Q-SOFA. This scale helps us to decide if a patient is in sepsis or not, and then we have the chance to evaluate properly and start the best treatment, of course. On definitions, we all know about it. Just sepsis is a life-threatening organ dysfunction caused by a deregulated host response to infection, okay? Septic shock is for you. Symptoms of adult sepsis for all of this. We got again skin rash or clammy, sweaty skin, right? Fast breathing, feeling very unwell, extreme pain on the worst over, feeling very hot or cold, chills or shivering, feeling confused, disorientated, or slurring speech, not passing much or enduring, weakness or aching muscles, and fast heartbeat. We consider this the time. These acronyms says us that sepsis, it's about time. Time means temperature, infection, mental decline, and extremely ill. If we get this time acronyms done with the patient, we know that we are in front of a patient with sepsis. Source and spread of infection, I mean, could be related because it's the way we can get into a huge infection in huge troubles. Infection may originate from the patient endogenous, usually from skin, nasopharynx, or bowel, or from outside sources, exogenous. Often another person who may be either suffering from an infection or carrying a pathogenic microorganism. Carriers, usually healthy, and may harbor the organism in the throat, for example, diphtheria, in bowel, salmonella, or in blood, hepatitis B or HIV. Non-human sources of infection include water, for example, cholera, milk, about tuberculosis, or food, when we talk about botulism, and animals, about rabies, or birds, about psittacosis, and also the soil, for example, Legionella. I mean Legionella disease. The incubation period is the period between the invasion of the skin tissues of pathogens and appearance of clinical features of infection. I mean, the period of infectivity is the time that patient is infectious to others. The chain of infection is for you. We must evaluate infectious agents, reservoirs, portals of exit, modes of transmission, portals of entry, the susceptible host. According to this, we got the meaning about the chain of contagious, how infections and spread, and how it's easily to correct them. And remember, the eyes may look, but it's your brain that sees. If we don't know these meanings, we don't have the chance to complete all of these topics, right? I know it's a very long presentation, so let me send you the pool to take attendance. And according to that, well, as you fill the pool, I'm gonna send you the slides to the chat, okay? Okay, can you all watch the pool? Please let me know.
Yes, teacher. Yeah.
Okay, perfect.
Yes.
Great. I'm uploading the PDF with this presentation. And let me give you some information. As you know, we got in module 1, 16 sessions. 8 are for theoretical classes and 8 are for workshops. That kind of meeting that we got during the week. I mean, 2 theoretical classes and 2 workshops, right? This week, we got the chance to, how can I tell you? We have only 2 more theoretical classes and then it's gonna be the final test. That's the best way to say this. So in that order, I need you to start studying, start checking, and if there are questions, please let me know because there is not gonna be enough time for checking all of the information. Okay, the presentation is on the chat, the Zoom chat. Please let me know by a message that you got it, okay? And can you all watch the pool? I need one student more for filling this. I don't know who didn't watch it. Hello. Can you download the presentation, the slides?
Yes.
Okay, perfect. Thank you. If you fill the pool, that's great. Sarah, Laura, thank you. Great. If you fill the pool, you can leave. There's no trouble. Andrea, thank you. Dorian, thank you. Great. Okay, see you tomorrow, Pablo. Thank you. Sarah, thank you. See you. Don't forget to start reading and memorizing more and more. What? Okay, Pablo, Sarah. Okay. Well, it says that everybody filled. I'm closing this. Laura, can you watch the pool? Yes, thank you. Great. Dorian, okay. Elena, did you fill the pool? Could you watch it? Diana, thank you. Alejandra, did you fill the pool? Could you watch it? Elena and Alejandra, are you there?
Yes, teacher.
Hello.
I got it.
Great. Did you fill the pool, Alejandra?
No, teacher, I lost it.
Okay, let me send
I
it
don't know
again.
what happened. Okay, thank you.
Okay, let me send it again and you fill it, okay? Okay, can you watch it now, Alejandra? Alejandra, the pool is there.
Yes, teacher.
Okay.
Okay.
Okay, great. Oh, thank you. Thank you so much.
Thank
So see
you.
tomorrow. Okay, you got
Bye.
the presentation, right?
Yes, yes. Okay.
Okay, great. So I'll see you tomorrow. Bye-bye.
Bye-bye.
Elena, are you there? Elena? Elena? I don't know if you're there or not. I'm gonna close this. Okay, I hope you can download it.
Teacher, I did it before. I have to do again.
When you, no. If you did it in the first opportunity I send it, that's okay, no problem.
Could you check it, please?
Actually,
Or
I cannot.
I can fill it again if you want.
Okay, fill it again, please, just for being sure.
Okay, please.
Okay, it's open. Can you watch it?
Yes.
Okay, great. Thank you. Let me know, did you get the slides? Could you download it?
No, I didn't do that, teacher. I have problems with my cell phone. Could you send me inbox, please?
Okay, by inbox to your WhatsApp. I'm gonna send it, don't worry.
Thank you very much.
Okay, bye-bye.
Bye, teacher.
Okay, it's done. So see you tomorrow into the workshop.